Welcome to AGD 2022, the premier meeting for general dentistry. Hi everyone, I'm Allison Godlove. Welcome back to AGD 2022 live from Orlando, Florida. We are here for the second part of a two-part course, Dental Sleep Medicine, the search for reliable, predictable outcome to achieve maximum medical improvement. Now, if you were able to join us this morning, you might recall that portion was the lecture portion. This is a more hands-on participation part of this course. We want to talk to Dr. Ed Mueller. He is participating in this course today. Thanks for taking some time to talk with us.
Thank you.
And why did you choose this course?
I have some background in dental sleep medicine, so I wanted to get up to date on what's new, any new techniques, and it's a real need in dentistry to help people with this problem.
What are you most looking forward to with this participation part of this course?
Using the instrumentation that they've talked about this morning to actually find a great position for the airway, so to see how those instruments work, which save us a lot of time and titration figuring out what the position is. So I'd like to see how these instruments work.
Why do you think it's so important to participate in a scientific session here at AGD?
I love taking the AGD courses because they've been vetted. People here have to display their affiliations or sponsorships or lack of thereof. So the courses have been vetted and make sure that they're not just commercial or sponsored by some company.
We'll let you get to the class now. Thank you so much for taking some time for us.
Okay, thank you.
Enjoy and have a great time the rest of the time here at AGD. We appreciate it. Thank you. So for those of you who weren't able to join us this morning, we're going to let you listen to our interview with Dr. Kamisi. That was from the lecture part of this course. With me now is the speaker, Dr. John Kamisi. Thank you for talking with us.
Very nice to be with you. Good morning, Allison.
Yeah, it's great to see you this morning. So what are attendees going to get out of this lecture this morning?
Well, this arena of oral health, sleep, airway, sleep medicine, et cetera, is very, very important because a lot of the root cause of the disease that we see is emanating from people not being able to get effective sleep. And if you don't get good deep sleep every night, you don't get good REM sleep every night, your body goes haywire. Your brain is foggy all day long. You're not the nicest person in the world to be with all day long. And that's all because of ineffective sleep. Now, there are all kinds of things that are out there in the marketplace to try to help you sleep better, mattresses, pills, devices, et cetera, and so forth. But without understanding what the root cause of the problem is how effectively you are sleeping. If you're not sleeping well, you're waking up multiple times per night, which happens with people with sleep apnea, you are a mess, physiologically, mentally, et cetera. Your family suffers, you suffer, your work suffers. So being able to understand this important component of analysis and screening is what's going to help the dental profession move better and better, closer and closer to medicine, and helping medicine understand how to work better with dentistry.
It really is such an important topic.
Yes,
so someone who is attending this then, what are they going to be able to do right away when they leave this course?
Well, they're going to be able to identify people who may have this issue by doing effective screening, looking at the overall way that the tongue sits in the mouth. If it's too big, if there's scalloping, if there's all kinds of wear facets and basically wear and tear on the teeth, they're going to be able to say, there's something going on. And they're going to ask a simple question. Has anyone ever told you that you snore? Everybody's going to answer one way or the other. They don't give you a no. They say, yeah, my wife, my significant other, et cetera. The guys on the camping trip, they don't want to sleep with me. And once you ask them that, and then you ask them the second question, how many times do you get up at night to go to the bathroom? And they look at you like, how do you know that I get up in the middle of the night? Because if they have the signs and symptoms of any kind of sleep-related breathing disorder, there's always an issue. Their heart is running all night long. They're racing instead of resting. And their kidneys are functioning, their bladder is filled, so they've got to go to the bathroom. So this is an overall really pandemic circumstance, to use that horrible word that everybody's been using the last several words. But it's really insidious, and it happens to everybody. So by the end of today, people will be able to understand the signs and symptoms, be able to understand that we need to work with medical colleagues more effectively, especially our sleep physicians, to get people tested, to get people determined that they need treatment, and what types of treatment are going to help them.
That's the really great part about coming to AGD and being part of these scientific sessions.
Yes.
So what would you say to somebody about participating in future sessions or even coming to AGD 2023?
Well, AGD 2023 and every other AGD meeting is important because it's camaraderie, it's education. Being here, you are with your friends. It's unlike any other meeting that I go to typically. You know, I know some people at some meetings, but here I seem to know everybody. So being here, you learn things that you would never find anywhere else because you can get the hands-on component of the courses that we do. And you get the knowledge that is cutting edge in every way, shape, and form. So Nevada AGD 2023 should be awesome.
What does being an AGD member mean to you, and what has it done for your career?
The friendships that I have developed over the course of the time that I've been involved. I was trustee and Speaker of the House for the Academy until 2015, and it was wonderful. Got to meet them, and being here, seeing my colleagues, seeing my friends, the hugs, they're awesome. And again, this is the thing, everybody's a family at the AGD, so you certainly want to be a member. It's benefited me in my career. Now that I'm a professor at Medical University of South Carolina, it brings my credentials there. The things that I learned, I share with my students, and we become better because of that experience. And I become better because of my students. So it's really an awesome situation.
Dr. Kamisi, thank you so much for spending some time to talk with us.
An absolute pleasure. Thank you. Have a great day.
Thank you. You as well. We appreciate it. Thanks so much for joining us. We'll be back in just a few hours for some behind the scenes of the AGD convocation. We'll see you then.